So what does chronic lower lung disease mean? In healthcare, it means that a condition has been present for a long time and it reoccurs throughout our lives. So Dr. Ramadan alluded to the examples of chronic conditions such as chronic bronchitis, chronic asthma, diabetes, arthritis, heart disease, kidney disease, liver disease, dementia, and Alzheimer's. So the lower portion of our respiratory system, it consists of the trachea and the windpipe and the breathing tubes that we call bronchi and smaller airways that we call bronchioles. And then those tiny air sacs that take in the oxygen and get rid of the waste product, carbon dioxide, as we breathe out. So let's talk about COPD in African Americans. So COPD is recognized as a major health problem in America's multicultural Black population. There was a study called the COPD gene study, and it talked about the effects of COPD among various groups. And so it identified the genetic factors associated with COPD, specifically among the different types of Blacks in our community. So it discussed the prevalence and the morbidity of COPD in African American Black individuals versus immigrants. So what are some of the symptoms of COPD? You have fatigue, you have a chronic cough, you have a production of mucus, you have dyspnea, which means it's hard for you to breathe, especially on exertion when you're moving about. You have tight chest comfort, you have shortness of breath. So what are some of the causes of COPD? We know the main cause is smoking, and then we talk about air pollution. And we've learned also during the COVID period that not only is in the environment outside of our homes, but right in our homes, we can be having air pollution. Specifically, and we'll talk about that more in depth, when we live in multi-unit dwellings, such as apartments, we are subjected to secondhand smoke.